uninsurance in the country, and I want to start with that and set the stage a little bit for what the Affordable Care Act means for Latinos and how important health reform is for all of us. Is this better? I see people going like this. Can you hear me better? Okay. So with that said, according to a poll developed by the Robert Wood Johnson Foundation and Latino Decisions, 30% of Latinos in the United States do not have health insurance. Think about that for a moment. What does it mean when you're sick, when you have to go to the hospital, when you have to take time off of work, when you develop a chronic disease? What does it mean for you to not have health insurance and to know that there's a chronic disease that you need to take care of? There's a lot of fear that goes into thinking about going to see a doctor, about having to make those payments, about having to take time off of work to go get whatever health disparity or chronic disease you may have. So that means that the Affordable Care Act is very important for the 9 million Latinos that by the year 2014 will be able to have some type of control over their health care and that will be able to make some decisions when it comes to their health. When it comes to health overall, the Latino culture doesn't think about going to the doctor on a routine basis. You go see the doctor where there is something really wrong with you. And when it comes to prevention, that is not something that we're thinking about. We're thinking about how to make those payments on the house, on the rent, purchasing food. Food insecurity and hunger in America is becoming a much greater issue. And so you're thinking about the now, not about the tomorrow. However, when it comes to healthcare, we need to think about the now. We need to go see the doctor on a regular basis. We need to think about prevention because going to see the doctor today will save us not only time and money, but it'll also save us very intensive, extensive treatments that cost a lot of money and that'll take a larger toll on our bodies. So with that said, the lack of information or misinformation is a big issue for Latinos across the country as to why more Latinos are not getting enrolled into these different medical services and plans that are available to them. There, again, is a lot of fear. There's a lot of misinformation. There was a poll that I read from Univision that was released a couple weeks ago that said that about 30% of the Latino community thought that the Affordable Care Act had been repealed. And, it's shocking, but it is true. There's a lot of people out there that do not have the facts, and so that's where we need to start. We need to start off with laying the groundwork for what is the Affordable Care Act and how do you as individuals benefit from it. And then we need to start getting into those conversations around the governing boards, around how we can contribute to those conversations and to the diversity that needs to go into ensuring that those governing boards represent us, represent our needs, and that also address the various issues that we have to deal with on a regular basis. Once Latinos find out about the Affordable Care Act and how they benefit, there's research that is showing that Latinos become engaged in some way, shape, or form, either by getting enrolled, seeking information, or talking to the doctor about their children and how their children can seek those services. If we are not there providing the information as these researchers are collecting the data, then how do we expect them to provide the services that we need? So we need to make sure that we're informed about all of these different data collection opportunities where we can provide that input. Without the participation of the Latino community, there's only so much information and focus that can be placed on improving access and quality. As I mentioned earlier, the focus on prevention rather than treatment is a big step for the community, especially because Latinos tend to get tested at later stages of chronic diseases. As you can see, communities of color, especially Latino communities, will be able to take a large advantage of these new opportunities, especially those that are provided by the new marketplace exchanges. So it is important that the governing boards look like us and that reflect our opinions. Given that Latinos play a large role in the fact that they don't have uninsurance and they're going to stand to benefit the most from these new services, it is important that Latinos are at the table and that our opinions are expressed. And so with that said, I want to echo Jim's comments from this morning that we need diversity on the governing board and we need to make sure that we are holding those folks accountable for the services that they're going to provide. Thank you.